Hello and welcome this first Monday of Daylight Saving Time 2012.
We're glad you're watching Pro News 7. Imagine needing an ambulance and not being able to get to the closest hospital. Sometimes the ER is so busy, that's what happens.
There's no room for any more patients, and when it happened in Amarillo over the weekend, one nurse made a rare call.
Pro News 7's Betsy Golden tells us what that was.
When a nurse feels she's been asked to perform an assignment she believes is unsafe for a patient, she can invoke something called safe harbor. Saturday afternoon, a nurse decided to do that at Northwest Texas Hospital.
The nurse called a safe harbor, but within a very short period of time it was rescinded because we were able to bring in the appropriate additional staff.
Anonymously, one nurse called Pro News 7 to tell us about her concerns. She said she had worked at the hospital for many years and said she was worried about the situation and concerned the emergency room could be closed down temporarily. We're told the ER was not shut down, but it did have some overcrowding.
We experienced a very surge in our patient population. So because of that surge, we went on diversion. And what diversion means is that we do not accept any ambulance traffic.
In that situation, if a patient is being transported by ambulance, he would have to be taken to another accepting facility.
We continue to accept trauma and STEMIs, which is with the heart, because that is by law.
They also continue to accept walk-ins, but again, Martin says Northwest Texas Hospital was able to rescind the safe harbor call quickly.
We were able to bring in additional staff.
Nurses who call safe harbor have the chance to go to a peer review and explain what they feel is best for them and their patients. The nurse in Saturday's scenario will not suffer any repercussions, including repercussions with a nursing license. Betsy Golden, Pro News 7.
Now, Martin says it is common for hospitals to experience overcrowding.
And she says it can be caused by anything from a need for additional staff to a lack of beds.